Hello, everyone. My name is Emily Hosford. I am an occupational therapy doctoral capstone student, and this is the video series of autism and feeding challenges. Thank you for watching. This specific presentation is focused on feeding is sensory and understanding the sensory components of feeding to help autistic children. The objectives of this presentation is to describe the different sensory properties of feeding that can impact autistic children and identify strategies that can help with sensory differences during meal times. So looking at the sensory differences in autism, it's common for autistic children to have sensory processing differences. So some children are hypersensitive, meaning that they are extra aware of all the sensations in their world, and some are hyposensitive, which means that they are less aware of everything that's going on in their world. This can be a combination for different senses. So one person can be hypersensitive to sound and hyposensitive to taste. So it's a spectrum. It all depends on the kiddo. Some terms that are important are sensory defensiveness is when a person's body overreacts to sensory experiences that other people may seem as neutral. A common example is like touch. May be reactive towards touch and find it more unpleasant than someone else may. A lot of children with autism have sensory defensiveness and sensory aversions. And a sensory aversion is when a person does not like sensations that overstimulate them, they avoid it. And they are aversive to sensations. So looking at the different components of feeding, those sensory components, feeding is very, very sensory. It requires all of our sensations, and we expect people to feed multiple times a day. So if you are hypersensitive, or hyposensitive, requires a lot of different sensations. So we'll just review them all. It's more than just the 5. There are 8 different sensory components associated with feeding. So the first one, sight. How a food looks will impact if we want to eat it. How it smells impacts our appetite, and if it smells good or if it doesn't smell good impacts if we want to eat it. The sound that food makes when we eat it is not something we always think about. So like the crunching, we could hear that. The squishing, there's lots of sounds when we eat. Another one is touch, and touch and texture, how a food feels in our hands, how in our mouths, that changes the way we eat and if we want to eat something. The next 3 are not as well known, but proprioception, body awareness. This is how we recognize our own body positioning and the force that we use when we move our body, and that impacts how we bring food to our mouths. The next one is vestibular, so our sense of balance and our sense of movement. This will be how our body maintains upright and a good posture and positioning when we eat, and how we use both sides of our body to eat and move. The last one is interoception, so recognizing our body's internal cues. This one is a little bit more challenging for folks with autism, and how we respond to hunger and recognize hunger and our fullness, and can we recognize our internal cues? That's going to impact how we eat. So what does this mean altogether? Sensory, autism, and feeding. What does it mean altogether? Eating new foods can be a very scary sensory experience. If you get easily overwhelmed with what you see, hear, feel, taste, we know that feeding requires all of that. So if you get overwhelmed easily, it may not be an experience you particularly enjoy. Autistic children may prefer the consistency when they eat the same thing. There's predictability. You know how it's going to taste, sound, hear, all of those senses you already know. and can predict what's going to happen when you eat the same thing over and over again. So eating something new can be too overwhelming, and they may prefer to eat the same thing. Autistic children may also prefer rigid routines around eating, like using certain cups or eating in a certain place, using certain utensils, a preference for certain packaging for how something looks, preferring certain brands. So that's pretty common. And then because of all of this, autistic children may need more time and exploration with new foods before they feel safe to even try them. So here are some sensory tips and suggestions. The first one, because it takes a lot of time to feel safe, be patient, keep calm. You're doing a good job. But patience is very, very key. We also recommend we play with foods. So like in this picture here, this kiddo's playing with macaroni noodles. Another way could be playing with different sauces and painting with yogurt and finding different ways to be playful. I've seen people do chocolate chip races where you put chocolate chips in a cup and who could do it the fastest. And that gets them used to having the different textures and melting chocolate on their hands. Can you make faces out of pizza and things like that? Being fun, being creative. We also recommend describing how food looks, how it smells, feels, tastes, all those sensory experiences. If you share what you're experiencing, it gives them another opportunity to learn and explore before trying it themselves. So this food looks hot. This food is red. Oh, this feels squishy in my mouth. Oh, this is crunchy. I wonder if it's crunchier than this other food. So being objective and using those senses to describe foods. Another one is model touching, smelling, kissing, licking. These are all the steps that are the steps of eating before eating. So can your kid tolerate touching, smelling, kissing, licking? Those are all ways to explore food without pressuring them to actually try it. So if you model it too, maybe they'll learn and model it back and just gives them another opportunity to learn. Another one is to break down larger meals into single ingredients. For example, spaghetti is usually all mixed together, but could you break it down into just pasta in one corner of the plate, sauce on one corner, meat in the other corner? Then it may not be so overwhelming and it's not as much of a sensory ask when they're all mixed together. And then lastly, give age-appropriate food-related chores. This can be filling up water for the table, setting out napkins, setting up the plates, serving, helping with cleanup, putting food into Tupperware, cooking, helping you cook even. This gives exposure if your kid is able to do these things, exposure to different foods, and just another way for them to learn about foods without being pressured to try it. So something that's very common is a food jag. And a food jag is when a child eats the same food over and over. And then over time, they start to burn out and get tired of that food and no longer accept that preferred food. So this can be very stressful for families and that have kiddos that have already a limited variety in their diet because it feels like that's one less food that they can offer and that their child would accept. So what we recommend is to offer the preferred food periodically, maybe every other day, if possible, and try food chaining. And so food chaining I will describe right now. So food chaining is when you break down new foods into smaller steps. For example, if your kiddo eats pizza and you want them to eat a grilled cheese, that might be too big of a jump. So what are different steps that we can break it into so that it's not so overwhelming, it's not too much change, but it adds variety and helps increase their diet. So we recommend try introducing new foods that are similar in taste, texture, and presentation to your child's already preferred food. So an example, chicken nuggets. If your child accepts chicken nuggets, could they accept chicken tenders of the same brand? So it's just changing the shape. And then maybe from there, homemade breaded chicken and then chicken. With food chaining, it's also important to remember that for autistic kiddos, it takes a long time. Change is hard. Be patient. They may not accept it right away, but exposure is good. And take your time and be patient. So here are some resources that are helpful for the sensory components of feeding. These first two Instagram accounts are for children as a whole, and the next one are specifically for children with autism. Some good books are, or this next book is Ways to Play with Food, if you're interested in playing that way, and then more examples on food chaining. Here are the references to this presentation, and thank you so much for watching. I hope you found it informational, and please check out the other ones in this series for more information. Bye.